So we've looked at the assessment of the patient kind of on the bed and a lot of the acute assessment and some of the strength markers we'd be looking for within the management and kind of assessment of these injuries. What we're going to look at now and move on to is the assessment of these patients more as the process goes on and assessing their readiness to return to different stages of sport, running, kicking. So what we'll start off with is some assessment of kind of kicking and thinking about how and what our patients are going to have to do and the demands that's going to be placed upon the anterior thigh. So as we've discussed, the rectus femoris is kind of really predominantly working and under a lot of eccentric stress, and there's that stress done in hip extension and also at speed. So we're thinking that a lot of our measures that we're using to kind of progress through safe progressions are going to have to be done at kind of increasing speeds, increasing ranges, but always under that eccentric load. We know that from kind of pre-season screening data that's out there, that there isn't really a huge correlation between kind of concentric strength markers and subsequent injury. And the reason behind that is probably a lot of these are done in sitting and in a concentric action, and the speeds that are done at in terms of isokinetic testing might be 30 degrees, 60 degrees per second, and that isn't what our patients are going to be exposed to when they go back to sport. So that, for me, is why there would be that kind of lack of correlation between true strength markers and subsequent injury, and we have to think about that in terms of our ongoing assessment. What markers are we looking at? What are they actually exposing our patients to? And how can we really factor them in to give a safe progression back to return to sport or return to the actions that they're going to have to do within their life? Okay, so one of the really good tests for me in terms of assessment, in terms of a safe return to play, is looking at the drop lunge. So if we're thinking about that kind of reverse lunge action, we're going to take that injured leg into hip extension. We're going to take it into knee flexion action as well. There's a big eccentric component to that. And again, thinking back to what we've just discussed in terms of, is this test relevant and appropriate? For me, this drop lunge is one of the real good tests that we can look to do. And there's a bit of a continuum in terms of the way I think of it, in terms of kind of getting them back to jogging, getting them back to kicking, getting them back to high-speed running and sprinting. The test can be really progressed and it allows us to have confidence as we're moving through each stage. So what I'd like you to do, Jack, to start with is just do a reverse lunge. So if your right leg goes backwards, so again, if we're thinking about that action and where they finish up, thinking back to on the bed in terms of that Thomas test, they go into that hip extension, knee flexion position with a nice high hip and knee on the opposite side, thinking about that running gait pattern. So this is just a really easy start into it. Are they feeling any symptoms? Are they feeling any kind of apprehension? And that probably is going to be the biggest thing in terms of going back through, thinking some of the hamstring data that's out there in literature around kind of patient happiness and apprehension to perform sprints and high speeds. For me, this comes into this test. Are they happy and willing to perform this test as we go through it? Because physically we'll probably have exposed them to similar sort of things within rehab, but this is a really nice return to play marker. So what I'd like you to do to progress that now is to start in that position, jump upwards as high as you can, and then land in that drop lunge position. So that back leg's going to be nice and long, nice and extended. So in your own time, if you jump up and then split the legs. Perfect. So if you just perform that a couple of times for me. Again, so we're wanting to cue if you can keep that chest nice and tall. Good, we're thinking about what's the hip doing. We don't want them coming into too much flexion and they're actually offloading that proximal aspect of the rec fem, which is what we want to test. Good, and relax for me. So thinking about what they're doing, how they're doing it, can we get that hip as long as possible and can we get that chest nice and tall? So that's the first stage. And I'd be pretty comfortable if someone could kind of perform that 5 or 6 times, no apprehension, be comfortable that they're appropriate to go back outside in terms of some sort of jogging action. We're not exposing the hip to too much speed. The way that hip flexor, knee extensor is going to be working, nice and easy, low level, but we know that they can absorb some load into that. What I'd like you to do now to progress that and thinking about maybe going back into a bit more maximal ball striking or quicker speed running. I want you to perform that action, but then keep switching. So you go right leg back, left leg back, and I want you to do it continuously 3 times on each side. So you're starting from that double leg position, dropping into your lunge, coming out of it and switching straight away. And switch, good, and again. Good, nice, keep going until you've done 3 each side. Good, and relax, perfect. So again, what we're thinking about is that's trying to translate that into a bit more of a running gait pattern, having to be able to absorb it, come into a concentric action to flex the opposite hip, and then reabsorb it again, going concentric to eccentric, going away from just that individual test that shows they're happy to do it once as a one-off. We're wanting to see that they can repeatedly do it at speed, bit of instability, bit of rotation. Again, thinking about the 3D nature of that tendon proximally. Are they happy to do that in that area? The final one I'd look to do is kind of add a little bit of an unknown, a bit of a reaction to it. Again, if we think about the game of football, it's not kind of pre-planned. They're going to have to do a lot of things unexpectedly. So what I'd like you to do is run on the spot with your knees as high as possible. And when I give a cue, which will just be me clapping my hands, I want you to suddenly drop into that drop lunge with that right leg back for me. And just hold it there. Okay, so nice high knees, good, really working those hip flexors. Good, so they're having to do it unknown, at speed, kind of potentially under a bit of fatigue, so we can really get them doing that high knee running for as long as we want, in terms of that we can get them doing it 30, 45 seconds, really try and pre-fatigue those hip flexors before then having to absorb an eccentric load. Loads of different other progressions of this, but it's just thinking about what are we exposing them to, how we can add some external load in terms of a weight at the shoulders, we can add a band around the knees so that again there's a bit of an overload into that eccentric action. It's kind of up to you how you want to play around with it, but I think this test is really nice because it allows lots of different progressions and it gives us confidence that they're comfortable absorbing load at speed eccentrically.